Hi, my name is Micah Larakis, and today I'll be presenting on cholecystitis and cholelithiasis. A clinical representation of cholecystitis would be a 40-year-old woman comes into the ER complaining of pain coming from her upper right abdomen. The pain comes in waves and worsens when she eats fatty foods. She had given birth almost 1 year ago and has experienced rapid weight gain since then. She occasionally endures back pain and frequently complains of indigestion and nausea. So, what is cholecystitis and cholelithiasis? Cholelithiasis is the formation of gallstones, and this is directly related to cholecystitis because cholecystitis is caused by the blockage of the cystic duct due to gallstones. And this blockage causes inflammation in your gallbladder, which is cholecystitis. And here's some background on cholecystitis. It was first recognized in 1844, and about 120,000 Americans are diagnosed every year. By the age of 65, 25% of women and 12% of men will have a sort of gallstone disease, and 10% of all patients with symptomatic gallstones will develop cholecystitis, and 60% of all cholecystitis patients are women. And here are some of the risk factors, and an easy way to remember it are by the 4 F's. It's female, 40, fertile, and fat. And according to this picture, there's also a 5th and 6th F. The 5th F would be fair because it's more prevalent in Caucasians and they have fairer skin. And family history, which is the 6th F. Some more risk factors can include liver transplants, pregnancy or post-pregnancy, or rapid weight gain or rapid weight loss. And the last is, of course, a history of gallstones. And on this next slide, I will be discussing the pathophysiology of cholecystitis. So, as I mentioned earlier, cholecystitis is the blockage of the cyst duct by a stone. And how do these gallstones form? So, they could be caused by the liver producing more cholesterol than it can take. So, the excess cholesterol makes this crystallized precipitate that sits in the gallbladder. There can also be excess bilirubin, which can also crystallize, and another thing called gallbladder hypomotility, and this is due to the gallbladder not emptying effectively. Next are the signs and symptoms. So first, on the picture to the right, there's fever, pain that extends from your right shoulder to your back, pain in the center or upper right of your abdomen. You can also get nausea or start vomiting, and there's, of course, bloating. Some more of the more common signs and symptoms would be tender abdomen when touched, meaning when someone presses on your upper right abdomen, you feel like a sort of pain, and fever, chills, and sweats. And the last one would be jaundice. So jaundice causes the yellowing of your skin and eyes, and this is due to the excess bilirubin. So, how is cholecystitis diagnosed? There's one of two ways they could do. There's either a lab or imaging testing. In lab testing, they will do a complete blood count, which means they will be counting your white blood cells, and if it's a high amount, it indicates an infection. They can also evaluate levels of serum lipase and amylase, electrolytes, alanine aminotransferase, which is ALT, aspartate aminotransferase, which is AST, bilirubin, calcium, and albumin. And if any one of those are also elevated, that is also a big indicator of cholecystitis. And lastly, imaging testing. They can do one of two image tests. The first one is an ultrasonography. This will demonstrate whether or not the gallbladder wall has thickened, and if it's thickened to 4 to 5 centimeters, or if there's an edema, that indicates cholecystitis. The last one is a cholecystography, which is also known as a HITA scan. This is where acid is inserted and it's taken up by the hepatocytes and brought in to the bile. You'll see that if a cystic duct is open, the acid will end up in the gallbladder and it'll be shown on the imaging. If it's not open, you'll see that there are gallstones blocking the entrance for the acid. So on this slide, it just demonstrates a HITA scan. On the upper left corner, that is the very beginning picture, acid is inserted, and then as you read across, you can see that the liver is getting a little bit darker, which means the acid is starting to move in through. And then as you go down, you can tell that the acid is going down further up until you end up in the lower right side, where the entire bile duct is covered in that acid. As for treatments, a patient with cholecystitis can get a cholecystectomy, which is the surgery removal of gallstones. They can also fast, and with this, it takes stress away from your inflamed gallbladder, and IV helps prevent dehydration from occurring, antibiotics to help prevent an infection, pain medications, obviously, because it's painful and swollen, and they can also have an endoscopic retrograde cholangiopancreatography, which is abbreviated into ERCP. And this is where they remove the gallstones from your common bile duct. And as you can tell on the picture on the right, the green is the normal gallbladder, and onto the right, it's your swollen gallbladder. And there it's because of swollen mucosa, and then you also see the gallstones. And then here are my references. Thank you. Hope you enjoyed the presentation.